Welcome back. Thanks again for joining us. Now, HIV/AIDS is back in the spotlight, and rightfully so, because the battle has not yet been won. South Africa or any other country, in fact, cannot afford complacency in the fight against HIV and AIDS. New infections are still very high among teenage girls between the ages of 14 and 24, and little is being done to curb this problem, as some might say. Now, this is the view of some of the HIV researchers attending this year's 7th AIDS conference being held at the Inkosi Luthuli Convention Centre in Durban from today until Friday. To talk to us a little bit more about this, we're joined from our Durban studios by Professor Salim Abdool Karim. He's the director of the Centre for the AIDS Programme of Research in South Africa. Prof, a very good morning to you. Thank you so much for joining us.
Good morning.
Professor, to what can we attribute this apparent increase in new infections among teenage girls in particular between the ages of 14 and young adults 24?
Well, if we look at the global situation, we see that HIV infections at a global level are declining. However, there are several countries where the declines have not been equivalent to what we're seeing everywhere. And South Africa is one of those countries that has not been seeing declines in some groups, particularly young women. So if you take South Africa having less than 1% of the world's population, we have about 18% of all the people living in the world with HIV. And in South Africa, young women, teenage women in particular, adolescents, are disproportionately affected. And there are a whole range of reasons for that. But one of the main reasons is the age partnering pattern. In other words, it depends on the age of the partner that they are sleeping with. So when younger women sleep with men 5 to 7 years older, they carry a much higher risk. And there's much that has been done to try and improve this, but we have a long way to go.
Some may directly link it to that phenomenon of sugar daddies, which can also be linked to poverty and young girls trying to find a way out of poverty through associations with these older men. Is there any substance to that argument?
Well, I think sugar daddies is a very small part of the problem in the traditional sense of sugar daddies, where you have substantially older men having relationships with very young women. So I think while that is a small part of the problem, the real part of the problem is that men in their 20s, late 20s, early 30s, they are the ones that have jobs. They are the ones that are able to offer young women many opportunities. So this is not the very traditional thought process about sugar daddies, but rather it's a situation where young women are seeking relationships with slightly older men because of the financial advantage that that brings.
It's quite a dichotomy when we speak about progress being done in South Africa when it comes to HIV, because a lot of strides have been made and there's been successes on a number of fronts. Mother-to-child transmission decreased, lifespan, etc. But at the same time, we do speak of these challenges that we're seeing. Speak to us about that mix that we're seeing and that contradiction.
Well, I think what we've seen in South Africa over the last 5 years has been nothing short of miraculous in the way in which the HIV epidemic has been tackled. We've tested millions of people. We've put almost just over 2 million people on treatment. We have reduced the risk of a child being infected from a chance of 1 in 3 some 10 years ago to a situation now where the risk is less than 1%. So there's no question South Africa has made enormous strides in the HIV epidemic. However, we have remaining challenges. And among those challenges is that we continue to have high rates of infection in some groups in South Africa. Men who have sex with men, in young women, and in those particular groups, in sex workers, we're seeing the HIV epidemic not following global trends. And so we have to find new ways. We have to be innovative about the way in which we get to those groups and try and reduce new infections in them.
Some might argue that one of those innovative ways of dealing with this phenomenon is to make sure that there is stakeholder engagement. Public, private partnerships, NGOs, civil society, you name it, all hands on deck. Which brings me to the work that you do as CAPRISA. What is it that you do and how are you contributing towards eradicating this disease?
So we've been trying to find new ways to empower women by making new technologies that women can use to protect themselves. So the current HIV strategies of abstinence, behavior change, condoms, circumcision are really technologies that mostly men can use. So if you talk about, let's say, a 17, 18-year-old woman coming to me in my clinic, and she says to me, you know, I have a husband or a boyfriend who's 25 years old, I'm worried about getting HIV, I'm trying to have a child, then for me, I have nothing to offer that woman. I can't talk about abstinence, I can't talk about being faithful because she'll be faithful to the very man who's going to give her HIV. I can't talk about condoms if she's trying to fall pregnant, and circumcision protects men, not women. So we really don't have technologies, and so what we've been doing is trying to develop those technologies. Initially, we developed a gel with an antiretroviral drug called tenofovir. Right now, we are developing two very exciting new technologies. One of them is an injectable. So this is a long-acting injection, just like Depo-Provera and contraception. The idea is that we would give young women an injection and it would protect them for HIV for up to 3 months. Now, we don't know if it works yet, but that's part of the research. We're in the process of testing it to see if it can protect women. So that means we may be able to protect women with just 4 injections a year. The other is that we've discovered a woman in KwaZulu-Natal who has a very powerful antibody. Now, she just made this antibody to her own virus, but this is a very unusual antibody because it can kill most of the HIV in the world. Now, what we have been able to do is to identify this antibody and to grow it in the laboratory. And we are now trying to make it into a little injection that we can give subcutaneously. Again, the idea is that you take 1 injection every few months with this antibody, and we hope that it will protect you.
My goodness, thank you so much for that. It sounds absolutely groundbreaking, and we look forward to speaking to you closer to the time when the tests have been completed, and we hope for obviously some positive results there and a positive way forward in terms of dealing with this virus. Professor Salim Abdool Karim, the director of the Center for the AIDS Program of Research in South Africa, or CAPRISA. My thanks to the good prof for that. A quick ad break. When we return,